Welcome back to Midday Kentucky, everyone. Well, an ever-increasingly popular surgery for men is gynecomastia reduction, or what we know in the public is enlarged male breast. Now, nearly 60% of men suffer from gynecomastia, which can cause significant self-esteem issues. Dr. Jared Nimtz from Commonwealth Plastic Surgery is here to break it all down for us. How are you, my friend?
Good.
Good. What is gynecomastia reduction? Explain it to the public for us.
In certain men, they will develop extra tissue around their chest areas, which is undesirable for a host of factors, and they would like that taken out. And so through different means, we go in and remove that tissue.
Okay, and I can only imagine, because when we talked about this before we started doing the segment, you said it's on all ages, from young guys to older guys, and I can only imagine that the younger guys get teased a lot.
Yeah, it starts off in school, in adolescence, and usually that stigma stays with the person for years.
Okay, let's talk about the options. There are several options, but of course, you being a cosmetic surgeon, you can also do a cosmetic procedure, yes?
Yeah.
Talk to me about that.
So there's a difference, depending on what issues are at play, between a cosmetic procedure and one that would be covered by insurance.
How does that all work? Explain that to us.
Well,
break it down.
A patient would usually come in to see at least me, if not going to see their primary care doctor ahead of time, to look at what factors are at play. And then an assessment is done, and we make the decision to go in for surgery.
Okay, so here's a before and after of a patient that we've seen before. Now, the guy doesn't look overweight.
No.
This is not an overweight issue that all men have. So this is obviously surgery that he has had.
Right.
Talk us through the surgery procedure. How does it work? What do you do?
There's a couple different ways of doing it, but one of them commonly involves doing a little bit of liposuction together with taking out some of that tissue directly in that area. The whole surgery takes about 2 hours to do.
Okay. Well, where do you do the surgery from it? Like, is it like under the arm, or explain that?
So there's usually an incision that's placed around the nipple in such a fashion that that incision would be hidden with time, so that people would not recognize it as an incision.
So what are you removing? Tissue or skin?
Usually it is a combination of fat and glandular tissue. Sometimes there is a skin component as well.
Okay, so you were talking about alternatives. So, you know, you said you can have CoolSculpting, but we also want everyone to know it's not about going into the gym and exercising it out.
Right.
Because there is a big difference between muscle and tissue.
Right. So this is usually not just a fatty issue. So this is not something that traditionally CoolSculpting would be used for. This is liposuction together with directly taking out that tissue.
So these are amazing results. And you wouldn't even think, like, these guys look fairly young as well, that you've been working on. Talk to me about, if just say I'm 18, all right, I've left high school, I'm about to go into college where it even gets even more, you know, people pick on you even more, especially with guys. What is an age that you would recommend a guy coming in to see you?
I see a whole host of age ranges. Usually people, when they come in, are in their 20s and 30s, though.
Yeah. Okay, so I think the most important thing that we can take away from this is an option for guys. It's not a major surgery. You were saying about 2 hours, 2.5 hours. How much downtime afterwards?
Well, they have to wear a compression garment that stays in place for about 4 to 6 weeks, but overall downtime, about a week.
Okay, we appreciate you coming in. If you want to find out more information, but we also have a deal going on. Now you can have a free consultation over there at Dr. Jared Nimtz's office. Give them a call on 859-951-5080. Or, you know, just head on over, I say. Now, I know you do have to make an appointment, but guys, head on over. They've got a great website. Get over, have a look. They give you great information. We appreciate you coming in. We'll be right back after this short break.